Hello everybody, I'm Dr. Wayne Johnson with Geaux Chiro. Something I'd like to talk about today is something I see and chiropractors treat all the time, and that's low back pain. Now, there are a lot of different causes of low back pain, but I'd like to actually talk about one of the simplest things that causes it and one of the simplest things to correct it. And that's going to be what? Well, stability. So how do we get stability? Right? Well, first off, what causes instability? Well, what if I told you that instability was actually caused by weakness? And that's weakness in what? The stability of our core muscles. Okay? Our core muscles, which includes the ones here on the side, and also includes the, those little 6-pack, 8-pack muscles that everybody likes to flex on. When they get weak, that functional stability goes away and all of the pressure and weight comes down the spine. And you have these little joints back here and they're called facet joints. Now these guys are not designed to really hold any more than about 1/3 of your body weight. So what happens when you lose all the support? Well, everything comes down the spine and these little joints become overloaded. Now, I have some patients that have this thing called facet syndrome, which is pain that you don't even see on an MRI. Now, this pain is generated by a special set of nerves that actually go around these facet joints. Well, these facet joints are angry. They are red, hot, swollen, and irritated, and they cause a lot of pain. So, what do we do to fix it? Well, we actually turn on the support system, which are going to be these deep type 1 postural core muscles. Now, I know a lot of you are thinking, well, I hate to do sit-ups. Well, I have some good news for you, because the treatment that I use here does not involve a ton of sit-ups at all. It has nothing to do with that. Those are nice big type 2 muscles. We want the deep postural core muscles, right? So, on our next series, I'm actually going to talk about ways to turn these things on and get that back pain to go down or go away. Thank you. Okay. Hello, everybody. I'm Dr. Wayne Johnson with Geaux Chiro, and today we're going to talk about that low back pain that's from that postural core deficit. Well, we're going to talk about how to turn that on. Now, I told you and I promised you, I said it's not going to involve 1,000 sit-ups, and that is true. I'm going to show you a couple techniques that I like to use with my patients to start them out with to turn these core muscles on. And we have 2 different types to turn on. We have that deep type 1 postural core muscle that's really important. And then we also have those big type 2 global movers that everybody likes to look at. So, I'm going to start with the deep postural type 1 today. So, we want to lay with our knees bent first. You kind of want to take your fingers and you don't want to put them on top. You want to kind of have them here on the side so you can feel these side muscles engage. Now, you kind of want to have your head in a very neutral position. And this one is the one that's a little unusual because you're not going to be sucking in and doing a sit-up. What you're actually going to do is you're going to push your belly into your fingers a little bit, like that. And you're going to hold it. It's a gentle push, so you should feel it. Gently push up into your fingers. And you want to breathe. As you breathe, you want to maintain that push, that contact that you have with your fingers. Now, at first, it's going to be really difficult for people to do this. Sometimes they can't even do it for 10 seconds. But what I want is I want everybody to be able to do it for at least 5 minutes. Now, that sounds crazy. Well, the thing is, if you try this a little bit at a time, you'll actually be able to do it in a short period of time, usually a week to 2 weeks. And now, 5 minutes, does that sound like a long time? Well, imagine this. As you're sitting in a chair, most people, right, they don't actually use their core. They just kind of slouch, they lean back. So their core is not activated and it's not turned on. One of the things that we actually want to have to take the pressure off of our spine and off of those joints is core being used. So everyone has seen one of those chairs that kind of looks like this and it has a ball on it so that your body is forced to use its core when you sit. Well, if we're not sitting on one of these and your body's not being forced to use its core, turning it on when you sit in a normal chair is going to help with the stability and the support you have while you're sitting at your desk. Now, if you're going to sit at your desk, I don't know, during the workday, does 5 minutes now sound like a long time to have your core engaged? It's not. You should be able to do this for at least 5 minutes. Now, if you remember, I did say that a lot of my patients have a hard time turning it on for even 10, 20 seconds. This is where practice makes perfect. Now, the second thing that we're going to do, here's that type 1 position. Fingers on the side. Remember, push up and brace and breathe. And you should be able to, even if you're breathing, even if you're talking, be able to maintain that pressure and that contact. Now, we're not arching our back. We're not pushing ourselves up into it. This is all muscle. And remember, it's not up top, it's on the side. Now, the next thing that we're going to do is we're actually going to do bracing for your type 2. And that's going to be this, where you're actually almost sucking in a little bit and making it stiff and taut. And you want to alternate back and forth, if you can, for 30 seconds for one, 30 seconds for the other. 30 seconds for one, 30 seconds for the other. So what that would look like is 30 seconds of a push, 30 seconds of a brace, 30 seconds of a push, 30 seconds of a brace. Now remember, all of this is just muscular. You're not twisting, turning, arching your back. Your back is neutral. We're trying to have all of the work done by the muscles. Now, thank you very much, and we'll see you on the next one.